Hi there, my name is Alicia and this is my video submission for intradermal injection for BSN 225. First thing I'm going to go ahead and do is confirm that I have all of the proper supplies needed for the injection. I will go to the patient's room, provide privacy, and the first thing I'm going to do is go ahead and wash my hands and introduce myself. Hi, my name is Alicia. I'm going to be your nurse today. Can you please confirm your name and date of birth? The patient will tell me, and then I will physically confirm via their wristband the name and date of birth that it does match. So assuming that is all correct, I will then clarify, do you have any allergies we need to be aware of? No? Perfect. So I do want to let you know that we are going to be doing an intradermal skin test for you for tuberculosis. And then just let me know if you do end up having any questions. Common side effects of the area are going to be a little bit of redness and some swelling, but adverse side effects that I need to be notified of immediately are going to be hives and or shortness of breath or wheezing. And then again, do you have any questions? No? Perfect. So the first thing I'm going to do is, before I even prep the medication, is I'm going to verify via the MAR, make sure that I have the correct stuff, and I do. I'm going to go ahead and put on some gloves. And the order states that we need to be administering 5 TU, which is equivalent to 0.1 milliliters of medication. We're going to be injecting the 0.1 milliliters. I need to grab some alcohol. And you're going to first go ahead and cleanse the top of the medication. And while that is drying, I'm going to verify the correct needle. So I have a tuberculosis syringe here, 1 milliliter, 25 gauge, with a 5/8 needle size. And that is appropriate for an intradermal test. So now that has dried, I will remove my syringe. First thing we're going to do is pull up 0.1 milliliter of air. And then we're going to inject the air. Taking it, flipping this upside down. Gonna pull out 0.1 milliliter of medication. And we're gonna use the one hand scoop method to recap the needle. Oh, I need to verify with the camera. So here is the 0.1 with no air bubbles. Perfect. I'm going to remove these gloves. Perform some hand hygiene. And then the next thing I need to do is prep the skin, and then we will perform the injection. So before I even prep, I need to locate my area, which is usually 3 to 4 fingers below the antecubital space, and then about 2 inches above the wrist. So it will be somewhere in this area here. And then you also want to confirm skin integrity, make sure that it is good, intact, no redness, splotches, any discoloration. And as long as everything looks good physically, you will then palpate to make sure that there's no tenderness or anything located underneath the skin. So again, I'm going to go ahead and pretend this is my forearm here, and we're going to inject the medication right here. So I will put on clean gloves since I'm going hand hygiene. And I'm going to prep the patient's skin. That since I have identified my marker, I'm going to start in the middle and go out about 2 inches, allowing the skin to dry completely before administration. I'm going to set some gauze here. And then, assuming the area is dried, we're going to remove the needle, or the cap. Make sure that the bevel is up. And insert the needle at a 5 to 15 degree angle, and then only going into the skin roughly 3 millimeters. I'm going to use my non-dominant hand to hold the skin taut. And then I'm going to take my other hand, stabilize the needle, and then inject. Perfect. Place a little bit of gauze over that, not applying any type of pressure. I'm going to go ahead and use the one-hand scoop method to recap the needle here. And this needs to go in a sharps container. And confirm there is no bleeding, severe irritation, or anything. Perfect. Yeah.
Hey, I'm gonna head out, okay?
Okay, have a good night.
See you later.
Thank you, we'll see you later. And then confirming that everything is good there, I will confirm with the patient, are you having any adverse reactions? No. Do you have any questions for me before I head out? No? Perfect. So then I would clean up my supplies and I would go document the medication administration immediately.